Hello. So I had public health for this week's discussion post, and my understanding of public health is sort of like population medicine. So like large scale health initiatives that will directly impact individual health outcomes, which sort of results in an increase in just like the overall wellness of populations. And so like a lot of that is sort of like a macro level health interventions, and then a lot of data analysis around sort of what things look like in other countries, and then how to implement those here as far as American public health. And so the role of public health in trauma and trauma-informed care and trauma services is sort of looking at the adverse health outcomes. And so when I think of that, I think of like Paper Tigers that we watched, and sort of looking at all of that neuroscience that we looked at. So the way that trauma really is translated into our functioning and our roles in society and our health outcomes and things like that. And so that's kind of where those two things collide. And I think public health and social work really come together a lot, especially macro level social work, in the same way that I kind of think of like clinical social workers might work with like doctors or nurses. I think that macro level social workers would definitely work with public health people, just to kind of figure out what sort of policies and interventions could lead to the kind of the biggest bang for your buck. And so like this video this week is kind of talking about things like having fathers be more available for their kids and their families, and then the all of the health outcomes that correlates with, and then the systems that are in place that don't really work right now for us, like family medical leave only works, or really only applies for women for when they have babies right now. And so then that kind of creates more of a gap between fathers and then their children. That doesn't work for every family. And then of course that's not really practical for like people that are living paycheck to paycheck because pay isn't guaranteed. So I think it's just like large scale analyses of where health outcomes sort of parallel or cross even with trauma, and then figuring out ways to manipulate those and get the outcomes that we want through things that aren't just like one-on-one interventions, that are more like population-based and community-based. Okay, anyway, thanks. Hope you guys are having a good week.